My name is Megan Pike, and I'm a subspecialty resident in pediatric hematology oncology at the IWK Health Centre, Dalhousie University in Halifax, Nova Scotia, Canada. I'm thrilled today to present to you results of my study entitled "The Adolescent Menstrual Bleeding Questionnaire is a Valid and Reliable Tool to Assess Quality of Life Related to Heavy Menstrual Bleeding in Adolescents." I have no conflicts of interest to declare. 37% of adolescents experience heavy menstrual bleeding. Heavy menstrual bleeding has a significant impact on adolescent quality of life, including affecting school and sport performance. The assessment of heavy menstrual bleeding is challenging, and we often rely on surrogate measures to help us identify heavy bleeding, such as a CBC or iron studies. The pictorial bleeding assessment chart is a chart that an adolescent could use to keep track of the number of period products they use during their period to help us clinicians assess whether or not they may meet criteria for heavy bleeding. However, adolescents really don't like to use this tool because they don't like to keep track of the number of products that they use. There is a generic quality of life measure in pediatrics that is validated, and it's called the Pediatric Quality of Life Score, or PIDS-QL. However, this is not disease or bleeding specific. In adults, there is the Menstrual Bleeding Questionnaire, or MBQ, published by Matheson, that is validated for use in women greater than 18 years of age. And so our objective was to review and revise the Menstrual Bleeding Questionnaire for use in adolescents less than 18 years of age, and to assess its validity and reliability. First, we developed the Adolescent Menstrual Bleeding Questionnaire, or AMBQ, from the MBQ, validated for use in adults, by making word substitutions based on our experience with working with adolescents. So we substituted words that affected 8 total questions to make the questionnaire more appropriate for adolescents. Then a focus group of 5 girls with heavy menstrual bleeding reviewed and piloted the AMBQ and suggested we add one more question that assessed the effect of bullying. And so all in all, we developed the AMBQ, which consisted of 21 questions with a score range of 0 to 77, with a higher score indicating a worse quality of life. We then sought to validate the AMBQ, and we did so by recruiting girls with and without heavy menstrual bleeding over a 3-year period. We excluded those living with chronic disease. We asked the girls to complete the AMBQ, the PIDS-QL, and the PBAC, both at baseline, and then in 30 to 60 days for controls, and again in 6 months for those with heavy menstrual bleeding. We sought to assess validity by correlating the scores on the PIDS-QL with the AMBQ scores using Pearson's correlation. We then assessed reliability of the AMBQ in the population of girls without heavy menstrual bleeding and looked at interclass correlation with the AMBQ at 2 time points. We then used the receiver operating curve to assess the ability of the AMBQ to distinguish between girls with and without heavy menstrual bleeding. And here are our results. We were able to enroll 52 participants with a mean age of just under 15 years. 20 of those participants had heavy menstrual bleeding. We found that adolescents with heavy menstrual bleeding had a significantly higher score on the AMBQ compared to those who did not. We found a moderate correlation between scores on the AMBQ and the PIDS-QL, but the row was 0.63, which still supported the need for a disease-specific measure. We found that the AMBQ demonstrated substantial test-retest reliability with an ICC of 0.73, and this value was statistically significant. Then we used an area under the curve and found that a score on the Adolescent Menstrual Bleeding Questionnaire greater than 30 could actually identify girls with heavy menstrual bleeding with excellent discrimination and a specificity of 84%. So we concluded that heavy menstrual bleeding has a significant impact on quality of life in adolescents, and that the AMBQ is a valid and reliable measurement tool to assess quality of life in adolescents with heavy menstrual bleeding. The AMBQ may assist clinicians in identifying those with heavy bleeding and it is easily implemented in the office setting as it takes less than 10 minutes to complete. I would like to thank all of my co-authors, especially Dr. Vicki Price, who was my mentor and supervisor. I would like to acknowledge all of those at the IWK who helped us recruit participants for the study, as well as any adolescent who helped us by completing the questionnaire. Thank you so much, and please feel free to contact me with any questions.